My name is Lisa Hayes. I'm going to be chairing the session this afternoon. I'm the Manager of Lifestyle Services for MS Society in New South Wales, Victoria, based in New South Wales. I'm very pleased to be able to welcome you to the session on managing fatigue at work and at home. 80% of people with MS report fatigue as their worst symptom, and understanding MS fatigue and implementing relevant fatigue management strategies has proven to be effective in enabling people with MS to participate more fully in activities that give their life meaning and value. This session will explore the different types of fatigue that people with MS experience and a range of strategies to facilitate optimum management of this complex symptom. Andrea Salmon is an occupational therapist with 20 years' experience, although she would deny this, in her profession with varied work experience. She's worked with the MS Society for 3 years, and in her work with the MS Society, the management of lifestyle issues and the impact of fatigue for people with MS has been a major area of focus. So please join me in welcoming Andrea Salmon for her presentation on managing fatigue at work and at home.
Thank you, Lisa. I've got a question for you first. I need a show of hands. Hands up if you are someone with MS. And hands down. Hands up if you're a friend or family member of someone with MS. Thank you. And hands up if you're a health professional. Excellent. Anybody else that hasn't had a chance to put their hand up? This is not a workshop, but at certain times I'm going to ask for some responses from you. I figure it's the last session in the day. Fatigue is probably the worst topic to have at this time of day. So every now and again I'll check that you're awake by asking you a question. Now, I'm pretty sure that most people here are aware that MS is a chronic, often disabling disease that randomly attacks the central nervous system, the brain and spinal cord. The progress, severity and specific symptoms of the disease can't be predicted. Symptoms may range from mild, things like tingling and numbness, to severe, with paralysis and blindness. MS is a devastating disease because people have to live with its unpredictable physical and emotional effects for the rest of their lives. Symptoms of MS are unpredictable and vary greatly from person to person and from time to time in the same person. And the list of symptoms is on the screen. The overall cause of MS is still unknown. The healthy body's immune system normally defends the body from attack by viruses or bacteria, but in the case of MS, the body's immune system attacks its own myelin, causing disruption to nerve transmission. So symptoms vary from person to person and symptoms vary over time. Therefore, every individual is unique and requires personalised assessment, treatment and management strategies. Now, I'm sure you'll recognise on that list symptoms that apply to you, either now or in the past, or people that you work with or live with. Lisa explained the background to putting this together, so I'm assuming that the people that have come have a keen interest in learning more about fatigue management. So I want you to have a think about your experience of fatigue. I want you to think about whether fatigue is one of your 3 main symptoms and what you're hoping to get out of this session, so that by the end I hope that you've got what you want to get out of the session. 80% of people with MS report fatigue as their worst symptom, and I think most people would say it is one of their top 3 symptoms. So we're going to have a look at a bit more detail about what MS fatigue is, and we're going to have a think about and a talk about some strategies to help with fatigue. I've got a case study for you. Elizabeth is a 45-year-old woman. She's married to Leo and she has 2 primary-age children who are 11 and 8. Elizabeth has had MS for at least 14 years. Until recently, Elizabeth had lived fairly independently with her MS, working part-time from home and managing household tasks with help from her family. Elizabeth takes the lead in household tasks, in shopping and in cooking. I want you to tell me, what are Elizabeth's life roles? Call out something that is one of Elizabeth's life roles. Mother. Bit louder. Housekeeper. Let's see if my list corresponds. I've got some of Elizabeth's life roles as things like, she's a mother, I think we had that one. She's a wife. She's a lover. Maybe wife, maybe separate, maybe the same. Domestic management. She's probably a daughter. She's a chef. She's a chauffeur. She's a referee. And she might even be a tutor. And I think you've picked up on the point. There are many life roles that Elizabeth has. Each of us has a variety of life roles, and they vary. Well, several months ago, Elizabeth experienced an exacerbation of her MS that required inpatient rehab. Since then, she's had increased lower limb weakness, spasms in her legs, especially at night, and sensory changes, including numbness. Elizabeth also experiences bladder urgency. As well as her physical decline, Elizabeth has experienced some reduction in her ability to concentrate. In the afternoons, her cognitive problems get worse. The family has expressed some concern about Elizabeth's reluctance to accept help with managing the household. Without even meeting Elizabeth, what are some symptoms that you can identify from that? You can call out if you want to. Fatigue. You're coming up with a broad list. Some of her symptoms that we know already are some weakness. There was spasticity, spasms, some sensory changes, fatigue. There were bladder symptoms, cognitive changes. We'll come back to Elizabeth. Fatigue is defined as a subjective lack of physical and or mental energy that's perceived by the individual or the caregiver to interfere with the usual and desired activities. So as we said before, it's the most common symptom that people with MS report. It's often among the most disabling symptoms. In 2000, there was a study that defined fatigue as the most common reason that people leave employment. However, that word subjective means that fatigue is different for each person. It's hard to compare fatigue in two different people. And the cause of MS fatigue is very complex. The cause of fatigue in MS still remains obscure. There are a variety of proposals, and they include the impairment to the nerve conduction, axonal loss, immune dysfunction, physical deconditioning. You've got there's handouts on the table. If you're on a table that perhaps doesn't have enough, there are other tables that have got more than enough, so we need to share. The back page is a reference list, and there's an article there whose author is Robert Herndon. If you're keen to read more, that's an interesting article to get. He explains, in his understanding, that MS fatigue is thought to relate to the ongoing inflammatory process in the brain and the substances secreted by the immune system as part of its response. A lot of what we were hearing about yesterday. He talks about how this works when the body fights a virus, how we would recognise, as we talked about yesterday, when someone has the flu, one of the symptoms is exhaustion. You have to rest. And it's not necessarily that that exhaustion is a result of the virus, but perhaps the body's fighting of the virus. So perhaps that's what's happening in MS. He's suggesting that MS as an autoimmune disease may have a similar fatigue response, but there are quite a few theories to explain MS fatigue, and the bottom line is we're not quite sure. But it exists, and we need to consider management strategies that assist people with MS to fulfil their daily activities. I've lost a slide. Maybe it's after. It is. This is a diagram that comes from the Philip Kinkle article, which is also listed on your reference list. Philip Kinkle concludes that fatigue is one of the 4 major symptom groups. They're in the middle with the physical symptoms, cognitive symptoms and depressive symptoms that appear to be directly related to the disease process in MS. All 4 are interrelated and all occur within the context of an individual's physical background, psychological background and environmental background. We use this diagram to highlight to people with MS that fatigue doesn't stand alone. It's influenced by other aspects of our functions, and it influences other aspects of our physical function. So it's quite complex, but even in its simplest form, this diagram is good at showing the complexity of how MS symptoms interrelate and how fatigue works through all of that. When I meet someone who has MS and they tell me that they experience fatigue, the first thing that I like to do is to give them a better understanding of the types of fatigue that they're experiencing. And often just in doing that, in explaining to people that fatigue is an actual symptom of MS, it's a huge relief to people to think, oh, I thought I was imagining it. I've got this fatigue and it doesn't make sense to me. But to know that it's an actual symptom makes a lot of sense. The MS-related fatigue is a direct result of changes in the functioning of the central nervous system. But people with MS are not immune from regular fatigue that everybody experiences, so there's complexity happening there. Being able to distinguish what you're experiencing assists you to understand that you're not just imagining it, you're not being lazy, and then also helps you to identify management strategies that may be more specific to your type of fatigue. In your handout pack, there's a fatigue chart. We find this a useful tool to get a better picture of a person's fatigue and its impact. By giving you a picture of when fatigue affects your activities and looking at what else might be happening when you experience fatigue, it can be helpful to tease out MS fatigue and secondary fatigue. So in your handouts I've popped an empty chart and also the instruction for how to complete the chart. So you might find that that would be an interesting exercise to complete, to be able to have a look at, well, I know it's happening, but let me actually write that down and sort it out as to when it's happening and what's happening and what effect it's having. So we'll go on, we'll have a look in more detail at these. And Dawn covered a bit of this in her discussion, but we'll perhaps go into a bit more detail. So the first type of MS fatigue that we identify is lassitude. It's specific to MS. I don't know of any other conditions that experience this fatigue. Hitting the wall, no reason, but just can't do anything else. Got to stop. Can occur at any time of the day, for no reason. Usually worse in the afternoons. Now there's a connection there with, as we'll see later, temperature intolerance, but there's a link there with our own natural diurnal rhythms. Our temperature goes up a degree in the afternoon just naturally. And for some people, that degree of temperature change can be enough to have an impact on other symptoms. So it doesn't take much. That's why a lot of people recognise that there's an afternoon peak to their fatigue. Also MS-specific is the nerve fibre fatigue. And this was talked about earlier. This is the activity-related failure of the demyelinated nerve to conduct messages. So a nerve that's demyelinated has more trouble working, and the simplest way to understand it is that the nerve just gets tired of firing. People often find or experience this type of fatigue in an activity that's repetitive. So their ability to continue a repetitive activity suddenly diminishes. And the classic examples are things like walking around the block, get halfway around the block, and maybe a bit of foot drag starts to happen, not getting good clearance anymore, a bit tripping. Sit down on the fence, 5-minute, 10-minute rest, and I'm back to walking in a good gait pattern. I've had other people explain it to me with writing. I had a nurse one time explaining to me that she was expected to write all her reports at the end of the shift. Couldn't write for that long a period, all that writing all at once. Her clarity of writing dropped off. But if she could break the activity up and do it in steps and have a rest in between, she was able to maintain clear, legible handwriting. She was a nurse, not a doctor. This type of fatigue usually resolves with a short rest. That's perhaps a key difference. Then there's also the influence of temperature intolerance. As we've already talked about, the nerves themselves have greater trouble firing when they're warm. There's a whole lot of physiological sort of explanation which is a bit beyond me, but I know that when the nerves get warmer, they have more trouble firing. The message can't get through. Now, and that can cause a temporary worsening of symptoms. We can recognise it in a variety of areas. It can be things like having had a hot shower. That a difference in the temperature of your shower can be enough that when you get out, you've got to sit and rest. Can't get dressed now, have to do something else. It can also be when the weather's hot, but it can also be when you're running a temperature, so your internal temperature goes up. Referred to as heat sensitivity or temperature intolerance. Actually, I think I saw another term for it earlier today too. But then, as I said before, there are other types of fatigue that you're not immune to that we'd call secondary fatigue. So things like sleep disturbance. Anyone will experience fatigue due to disrupted sleep. Could be that you've got a new baby in the house and that disturbs everyone's sleep and everybody's fatigued. But in MS, the sleep disturbance could be due to bladder issues, or it could be due to spasms, it could be due to pain or depression. Then there's infection. Anyone that's sick with a cold, as we've already talked about, will experience increased fatigue and weakness. On top of this, people with MS may experience a worsening of their symptoms, including fatigue, when their core body temperature is raised due to infection, as we've just said. Exertion and deconditioning, hot on the trail of the exercise talks. A busy day or a strenuous activity will cause a normal sense of tiredness in everyone, as you've expended a lot of energy. But if we're not as fit as we should be, then we can all experience greater levels of fatigue than if we were fitter. However, people with MS find that if movement is difficult due to balance problems or weakness issues, then becoming fit can become difficult and can lead to further deconditioning and increased experience of fatigue. So, exactly as Katrina found, if we can become fitter and exercise more, our experience of fatigue will actually be less. Many medications can have the side effect of fatigue. Analgesics, anticonvulsants, antihistamines, muscle relaxants, asthma drugs, all can have a possible side effect of fatigue. Stress and depression are up there on the list. Symptoms of depression can be similar to the experience of fatigue. Depression is treatable and needs to be assessed by a specialist, and depression is also common in people with MS. Thinking about the environment can be a secondary factor in people's fatigue. Having to take the stairs because there's no elevator available. Poor lighting causes eye strain. An environment that's too warm or there's no air conditioning available, these will all add to fatigue. And then down lower there's mental fatigue. Having to concentrate for long periods. Sitting in a boring lecture. They all add to fatigue. And bladder issues can add to fatigue as well. I suppose they're connected up with sleep as well. But even if you're having to head to the toilet more often, that can be tiring too. So there's secondary fatigue as well as MS-related fatigue. And that chart is often a way of teasing them out by being able to think systematically about what is this experience of fatigue that I'm having, what might it be related to, what type of fatigue might it be, and then what strategies will fit that type of fatigue. If we go back to Elizabeth, we can tease out some of the types of fatigue and the impact on her life roles. Now, she hasn't expressed lassitude. She hasn't said or described that. But she may recognise that her feelings of tiredness don't seem to relate to how much effort she's put in. I had a quiet day, but I still feel exhausted. That might be lassitude. Spasms and the bladder changes, spasms at night, might be impacting on her sleep. So in actual fact, she's not getting a full night's sleep. She might be up 2 or 3 or 4 or 5 times a night. Her reduced ability to concentrate in the afternoons suggests cognitive fatigue, which might be a nerve fibre fatigue. She might be trying to do all the cognitively demanding activities of her work in the afternoon, and so she's fatiguing cognitively, as well as the temperature intolerance, as her temperature naturally goes up during the day. Her family, if you recall, was seeing that she wasn't managing the housework. Well, in fact, maybe what the family are seeing as not managing the housework might actually be a reflection of Elizabeth's prioritisation. What's important to her might not actually be as important to do all the household things. She might be putting her priorities in doing other things in her life. It turns out for this lady that involvement in her local church and weekday services at the local retirement home were actually a key important priority for her, as well as being involved as a volunteer at the local primary school. So thinking about how she rates the participation in the various activities that she's involved in. What does she place greatest importance on? Maybe like me, housework is right down low. So then there's a matter of considering how we would help Elizabeth manage her fatigue. Would she perhaps seek some one-on-one assistance? Maybe an assessment with an occupational therapist to look at some strategies. Tomorrow we'll hear a talk about a lifestyle planning service that operates in Melbourne. Maybe that type of approach, and we'll come on to that in a minute. Maybe a group program would be good for Elizabeth. Or maybe she needs to work with her physio and her doctor to look at some strategies. What did it go? Just hibernates after a while. Oh, we've gone off. Maybe Elizabeth needs to think a bit more about her priorities, because that might also be a way of helping her accept some assistance in some areas. It's ready to go. It's here. It's on here now. I should have touched it. I could make a joke that that's a bit like my husband, but I won't, because I might get back to him. He doesn't like sitting for too long either. I have to give him a little stroke. So Elizabeth's maybe at the stage now where she'll think about some treatment for her fatigue. Treatment's perhaps not the right word, but we'll have a think about treatment for fatigue. There are medications that can be useful for managing fatigue, but medications by themselves I don't think can solve the problem of fatigue in MS, but they can play a part in overall management. Some medications actually add to fatigue. We talked a bit before about that. Baclofen is a common medication for spasms, but one of its side effects can be drowsiness. Perhaps treatment of the underlying causes of sleep disturbance and other aspects of secondary fatigue might be a good starting point. For Elizabeth, that would probably be addressing her weakness and mobility, perhaps having her bladder urgency assessed. Maybe she doesn't actually need to get up that many times at night. Maybe there are some strategies that can be put in place so she can have a better night's sleep. Maybe she needs some treatment for her spasms, or the treatment that she's on might need to be tweaked, and that will give her a better night's sleep. So maybe we can treat some of the secondary fatigue issues. And then maybe we need some overarching fatigue management strategies, of which ultimately medication might be one, but maybe Elizabeth can come up with some strategies whereby she doesn't need to take some medication. She might be able to manage in some other ways and avoid taking something else. Now this is a bit like memory, you know, that game where you put up some things on the train, you've got to remember what they were, but it's actually not like that. In this picture, there are strategies for managing fatigue. So I want you to have a think about, and maybe a little talk on your table. This might be a little group activity. To see if you can work out what they are might be a start. What are the things in that photo? And why might they be a fatigue management strategy? So I'll give you a minute to talk amongst yourselves. Yes, she did say that too. Alrighty. What are they and how are they going to manage fatigue? You can be as creative as you like, and I usually get some weird and wonderful responses. I'll correct you later. A rope to hang your husband, yes. There were a couple then, and I missed both of them. Phone a friend? Oh, pre-programming numbers into the phone so you don't have to remember them. Instant dial. Diary. Easy meal preparation. Ah, yes, less washing with your tissues. Unless you happen to wash one in the wash, and then it's more washing. The eye patch for better sleep. The diary for planning. Relaxing CDs, yep. Tapes, they're very old, they're tapes. A delegation board. TheraBand for exercise. Can be. The cable can represent the internet connection, so you could do your banking online and things like that. Plastic to stop the rising damp. These all represent fatigue management strategies, some of which you've come up with, some of which you haven't. And these are just broad principles. One is balancing rest and exercise. One is planning and organising daily activities. Prioritising tasks. Energy conservation. Work simplification. These are good OT terms. Keeping fit. Healthy eating. Energy-saving equipment. Who doesn't have a remote for their telly? Relaxation. Postural support. Avoiding heat. Receiving counselling. These are all fatigue management principles. Oh, the social workers never like it because I always put tissues when it's their session. These are all fatigue management principles. And very soon I'll go on to talk about our fatigue management program that we offer people with MS in Victoria. And these are the principles that we outline through our program. So we'll probably go in a bit more detail into them shortly. The principles, though, don't work without a coordinated approach. So this would be coordination between your general practitioner, maybe your social worker, your physio, your occupational therapist, the MS Society and community agencies. It doesn't happen in isolation. It's a bit like, no man is an island. A coordinated approach is the best way to manage fatigue. Now we're going on to talk about this program, which is a 6-week education program conducted by the MS Society. So in under an hour, we're going to go through the 6 weekly sessions. The program includes information about the nature of MS fatigue, exercise and fatigue, adjusting to change, energy effectiveness, communication, and by the end of it, participants develop an individual fatigue management plan. Now, you've got a blank copy of that in your handouts as well. Because as we're talking, you might think, oh, now that's a strategy I hadn't thought of before, and you might jot that down. So it would be my hope that even though this is a lecture, you still might come away with some new strategies for managing your fatigue. This is the whole program. In your reference list, there's also a couple of articles that I've included there that are articles that have researched group presentation of fatigue management. So research has been conducted, largely in America, that has shown the effectiveness of a fatigue management program. And the principles have been talked about already today. The principles of self-management, the principles of self-efficacy, the principles of getting together as a group, learning from each other, supporting each other, and practicing strategies that are perhaps new to you. So often the strategies that we suggest seem simple enough, but it's almost changing habits. It's changing the way we do things. It's looking at things differently. There are lots of issues around these kind of programs as to where they can be run and funding to run them and who can access them. And I would encourage you to know that the occupational therapists from around Australia have met a few times this conference, and we're very conscious of making these strategies and these programs available to people everywhere. So while you might be in a situation where you can't access a group program like this, I hope it's not too long before you might be able to either access one through the web or in a rural area. There's lots of strategies being talked about to get these programs available much more broadly. One of the posters out there is about how in Victoria we have attempted to get these programs into the rural areas. Currently we only offer them in metropolitan Melbourne, but we have linked our rural resource workers with their local health professionals, trained them up so that they can offer it in rural areas. So that's getting off the ground, but that's one way of getting the program out to more people. So there are lots of things in the pipeline. In the first week of the program, we go into the detail that we have already today. We talk about lassitude, nerve fibre fatigue, heat intolerance and secondary fatigue. The cord is there because sometimes an electrical cable is a good way of understanding how nerves work. The insulation on the electrical cord is a bit like the myelin. It doesn't work so well if the cord's not in good condition, so the nerves don't work so well when they're demyelinated. This is where we use the chart that we've talked about already to try and explore what's going on with a person's fatigue. And the strategy from this session is knowledge. Knowing a bit more about it is a strategy to manage fatigue. To straight away know that you're not making it up, you're not imagining it, it's a real symptom, is a great relief for a lot of people. It's a multidisciplinary program that we offer. So in week 2, the physios come along and they talk about exercise. They talk about the balance between exercise and rest and relaxation. As Dawn has told us already today, they explain to people that exercise is not going to reverse or prevent the demyelination, but equally exercise won't cause a relapse or alter the course of MS. But a lack of exercise will cause disuse atrophy, weakness, stiffness, balance problems, reduced endurance, coordination problems. So it's important to exercise because it will decrease fatigue, it will improve mood, it will improve endurance, it will improve sleep patterns and decrease muscle stiffness. It will maximise strength potential, decrease constipation, reduce osteoporosis and many more positives. But the guidelines are to avoid overheating, to exercise in a safe environment, to avoid overexertion and to plan a rest break after exercise. And in that session, the physios take us through some stretching, strengthening and balance exercises, as well as relaxation as a valuable exercise as well. But we link that with the benefits of rest breaks. Rest breaks is often the first strategy we advise people with MS to incorporate. Rest breaks need to be planned, and then other activities planned around the rest breaks. So it's totally the reverse to how we function in normal day-to-day life. Rest breaks need to be quality rest breaks, and they need to be the right quantity for the individual. So even if you already have rest breaks, but you're finding fatigue is still a problem, maybe you need to adjust when your rest breaks are. Maybe your rest breaks need to be earlier in the day. Maybe they need to be shorter but more often, or maybe they need to be longer, depending what you do. And I've had a lady say to me one time, I rest, I have my rest on the couch while I read. I said, well, no, that's not a rest break. It's different, but a rest break means actually totally resting. Feet up on the bed. If you need to put your alarm on so that it will rouse you again in a little while, if you need to unplug the phone, if you need to close the curtains, you need a proper rest break. So it's closely aligned also to pacing, whereby you alternate your activities and you balance what you're doing to get the job done, rather than our normal way of, I'll just persevere and get this done and then I'll have a rest. No, it's better to break up an activity, spread it out. If it's very physical, you might break up that activity with a cognitive activity. Or if it's very cognitive, you might break that up with doing something different. And relaxation means we make the most of our rest breaks. So if your rest break is at work and your rest break is actually sitting in the car, having a relaxation tape or CD on would actually maximise that rest that you're getting. We spend the third week with the social workers and their tissues talking about adapting to change, the changes that MS fatigue is causing. And we try and look at reactions to those changes, and we recognise that these changes can be challenging and stressful, because MS has the potential to cause a lot of changes. But even more specifically, MS fatigue has the potential to cause a lot of changes. And we think it's important to acknowledge that and to spend time thinking about the changes that have happened and to think about our responses to those changes. So another part of your handouts there is a breaking the cycle diagram. Often when we're caused to make changes, we see that in a negative framework. By being able to perhaps try and, it might even be called spin doctoring, put a positive spin on that, might actually break the cycle of anger towards the changes, of the negative experience of that change. I had a young dad with MS who one of his key things that really frustrated him was that when it came to painting their house, he used to be the wall painter while his wife was the woodwork painter. Now he was the woodwork painter because he could sit and do the skirting boards and do bits at a time while she did the walls. And he found that change really hard to deal with. But he also was unable to work. What he wasn't seeing was the positive impact of him being home more for his kids, where a lot of dads don't get the chance to be home more while their children are small. So he had to break that cycle of looking at the negatives of the change and try and come up with some positives of the change. It's a real challenge. The fourth week is very much an occupational therapy week. We look at energy effectiveness strategies. We've talked in the first week about rest breaks. This week we talk about things like biomechanics, the posture and position that we use to do tasks. I always use the example of sweeping. When my kids were at kinder, the kinder teacher's sister was an OT. So every time I swept the kinder carpet, Elizabeth would say to me, "You'll know the right way to sweep because you're an occupational therapist." And I'd go, "I don't know the right way to sweep." But I know what she was meaning. She was meaning that whole consideration of how you do a task. Sweeping can be energy efficient or it can be energy draining, depending on how you do it and what tool you use. So can all sorts of other activities. So it's looking at being effective with the way we use our body. It's also thinking about, is there a tool that will help me do that? The energy that we save by having that remote. You wouldn't do nearly as much channel surfing if we had to get up and do it each time. But by sitting with that remote control for the telly, we can watch 3 shows at once. But it's also things like cooling vests. It's also things like home delivery. It's also things like getting a disabled parking sticker so that you can conserve your energy for actually inside the shops, not using it, getting from where you can park into the shop. So it's thinking about using your energy. We encourage in this session a visit to the Independent Living Centre. All states have an Independent Living Centre, and going and having a look at some of the equipment that's available. While it can be challenging for some people, it can be very opening as well, very inspiring to think that, oh, crumbs, that activity that I've always had trouble with, I actually could have a gadget to help me. They can be energy efficient as well, using trolleys and stools and things like that. In this session, we also think about the environment, the lighting, the temperature, even the layout. Every time I do this program, I go home and make further changes. The last one was where we'd put our kitchen table. I actually had to bring the groceries all the way around it to get into the kitchen. So we moved it a little bit and now I have a straighter line. Very simple, but you kind of just get used to doing things the way you've always done them. So maybe it needs going home and thinking, now I always struggle with that, or I always do it this way. Is there another way that I can do this activity? Planning and organisation, big in fatigue management. Am I balancing what I'm doing? Am I balancing what I'm doing today? Am I having my rest break as well as my physical activity? Am I doing my cognitive tasks at the time that I'm best to do my thinking things? How can I break these tasks up a bit? But then how am I balancing my week? Have I actually got whole full days and then days that are quieter? Maybe I could spread those tasks out over the week. That's where the diary is very useful in thinking about actually planning and